And this is about the use of drugs for spirituality, and the other side is for creativity. The spirituality aspect, I mean, people have been taking drugs. I mean, the ancient Incas took them, Native Americans, in Africa, in India. And so were they not being rewarded spiritually for that? And the other question, I'll tie it in at the same time, is for creativity. I mean, we consume drugs, or marijuana, hashish, charas, whatever, and it was to enjoy the music that came out of it and to be able to create it. And it's absolutely a fact, at least from everything that I've read, that it diminished once the drugs went down, the creativity went away.
That's the myth and the legend. When I had that conversation with Pete Townsend, the Who.
Right.
And I remember myself, I remember every year the Cleveland Orchestra would come to Boston and play, and I really liked them. And I remember one year we were driving to the concert hall, and somebody said, you want some pot? I said, no, I want to hear the music. It suddenly flashed on me, holy mackerel. Now Pete told me the same thing, you know, rock music scene, the music scene is full of drugs. And he said, absolutely, it mashed creativity. It, not the experience of creativity. It's like, that's the problem. You think you're playing well, and you're not. Okay? You say, hey man, that was a great concert. Hey, that was cool. Okay? It's a very, very interesting phenomenon. That is not to say that ideas couldn't come to someone in an altered state of consciousness, but if you want that, stay awake for 3 days. You'll be creative. A little goofy. Okay? So, you know, you whack your consciousness out. But there's another kind of analogy I use, and that is, isn't it true that people who go to war sometimes come back with much greater maturity and perspective on life? Soldiers, right? Now, is the lesson that everybody should go to war? No, it isn't. So it's the same phenomenon. And that is just because many people have gotten in car accidents and really come out the other side learning something, or serious diseases come out the other side and been much more mature and have a greater perspective on life. That doesn't mean you should go out and get in a car accident or get a serious illness. So the myth has been created that drugs are for that. Alcohol is much more associated with alcoholism with creative people. And the issue always has been, and it has been the case, that if they're able to stop, they're more creative. Okay? In other words, nothing can, you know, if you're a creative person, you're going to be creative, stoned or not. But the test is, does it last? That's what Mirabal said, ain't gonna last. And you might be creative one night, but you're not going to be able to duplicate it. That you got to work out. And Pete and I went around England and gave that message, which was very controversial at the time. But he'll tell you. I mean, he's got all the friends in the business, and the groups that hang in there really, they continue the creativity. They either get out of their addiction, or some of them die, or some of them are just not affected. But it's a good question.
Dr. Allan Cohen is a recognized expert in the field of substance abuse prevention with a unique understanding of drugs such as LSD and cannabis. A clinical psychologist, researcher, and author, Dr. Cohen received his bachelor's and doctorate degrees from Harvard University during the years of the original psychedelic drug research involving Harvard professors Timothy Leary and Richard Alpert, later known as Ramdas. His extensive personal experience and academic expertise with then legal psilocybin and LSD led to a distinguished career in drug abuse counseling, prevention, and treatment. After teaching at Howard and the University of California, Berkeley, he co-founded the Pacific Institute for Research and Evaluation, the USA's leading independent research institution specializing in prevention interventions for alcohol and drug programs. Dr. Cohen is considered the grandfather of programs based on alternatives to drugs and has written extensively regarding the motivations of consumers of psychoactive drugs.
My entry into the field was as a graduate student at Harvard, joining the experimental group of students under Professors Leary and Alpert, who tried LSD, psilocybin, and other hallucinogenic drugs. After a few years, I realized that these substances, though appealing, could be extremely harmful. And I was one of the few people who had gotten a doctorate degree at that time who was able to speak to those from personal experience. One thing led to another. I took positions at the University of California, Berkeley, in the counseling center, working as the drug and hippie counselor. And from then on, that was my career.
Okay. As a psychologist and counselor, please share with us a few incidents which motivated you to try and make a difference.
Well, I began to see that many of the people using these kinds of drugs were fooling themselves. Many of them were not able to work. Many thought they were having spiritual experiences that actually led nowhere. And it was clear that younger people trying these substances were going to get in a lot of trouble. And I wanted to share what I knew about them. We learned a great deal, actually, from not only scientists here in the West, but also philosophers and consciousness experts in India, for example, Meher Baba, who had very, very similar and parallel ideas about the potential harms, as did the scientists.
People have very strong opinions about marijuana. I'm sure you're well aware of the fact that some people promote the medical benefits of marijuana, while others say that it could be destructive. What is the scientific evidence that justifies making it available as medical?
The issue of marijuana is much more complicated than people think, and in fact much more complicated than the current experts think. The issue is really not about marijuana or cannabis plant. It's about the chemicals delivered into the physical and mental systems of individuals who use them. Let's take the medical aspect first. It turns out that there are cannabinoids that can be extracted from the plant that seem to be promising in some medical work, particularly for children, and may have some other benefits that are currently being studied. The difficulty is that the research does not discriminate right now these healthy chemicals from the psychoactive ingredient in cannabis, which is the delta-9 trans-tetrahydrocannabinols, which are psychoactive drugs very much like LSD and psilocybin. So we really shouldn't talk about the medical benefits of marijuana. We can only talk about the medical benefits of some of the constituents of that plant. On the psychoactive side, there is considerable more study of the negative effects of THC, particularly at high doses. Those negative effects, there are hundreds of studies that suggest problems with the brain, problems with later health, psychological difficulties, a much higher incidence of schizophrenia, and a tendency towards paranoia, tendency towards losing motivation, a 9% probability of becoming dependent on THC, and a number of studies that suggest that early use will in fact and can in fact lead to more significant substance abuse problems in the future.
Now, again, the research is difficult because we haven't separated out the people who have taken more of the THC in the new higher doses that are available today from those in the past who have had very, very low doses. That research is just starting, but it is actually ridiculous to talk about marijuana either legally or illegally because you have to separate out the components. That has not been done, and unfortunately the policies have not recognized that difference. In places, for example, in the United States where it's been legalized, we now see much higher rates of psychotic episodes, of emergency room visits, and the tendency towards edible THC. So the authorities are really becoming, just for the first time, cognizant of the effects of THC, for example, on driving. And unless you can test for the dosages of THC, it's very difficult to know the level of impairment. Another important fact that most experts won't tell you is that THC is stored in fat cells in the body. Now, marijuana is often compared to alcohol. Alcohol, certainly, and alcohol abuse have enough negative health consequences. But one thing about alcohol is it's totally metabolized, and certainly in 24 hours. With THC that's stored in the system, someone who thinks they're doing a moderate amount of marijuana is increasing the body's storage of THC. And again, we're just starting to research the possibility that the THC can be released under stress, and that people can have LSD-like experiences even if they haven't smoked marijuana greatly. Another emerging problem is the black market labs producing concentrated cannabis, extracting the THC into other products, sometimes called wax or shatter or other nicknames, which are very, very highly potent. So one of the analogies to show what the problem is if we discuss heroin, for example, we wouldn't be saying, well, should we legalize poppies? What's the poppy problem? Are there health benefits in eating or smoking poppies? Because all opium and opiates that come naturally come from the opium poppy, but it's not the opium poppy that's the problem. It's the morphine, or it's the opiate, or it's the heroin that's a problem. So we're really not focusing on the real issue. Now, people have different opinions about legalization, about decriminalization, about drugs being a public health versus a criminal issue. And those are being sorted out by legislators right now. Clearly it is a public health issue, but they cannot make an intelligent decision about marijuana unless they make intelligent decisions about the regulation of the constituents that are important. So it is very inefficient to say, smoke ordinary marijuana or eat ordinary marijuana for medical purposes, because the medical constituents are not organized or selected out. And additionally, the possible use of THC for treating alcoholism or depression, much as the experimentation with psilocybin and LSD now, would not be done effectively either by using cannabis, hashish, because of the multiplicity of chemicals involved. So it's much more complicated than people think. There's a strong argument that people with marijuana, cannabis, THC involved problems should receive treatment instead of being jailed. Certainly that's a reasonable view. On the other hand, there's arguments that unless you have some leverage over an individual who doesn't think they need help and is in big trouble, that it's difficult to get them into treatment. So we've experimented in the US, for example, with drug courts, which means that people who have drug offenses can get all the charges reduced or completely absolved if they go into treatment. But that's overseen by a judge who's especially cognizant of the addictions. The other response has been that people found in illegal possession of substances are immediately taken to treatment centers as opposed to going through the criminal justice system. It's a complex issue, and however one feels about it, it's terribly important that they know what they're talking about, and they don't. The policy has to be on the chemicals and not on the plant. In the same way, the policy has to be about heroin, has to be about opioid prescription drugs, not about the opium poppy or the chemical predecessors of these drugs.
Just to add, you've already talked about decriminalization and legalization of marijuana, especially in Canada. It's a huge debate. When we talk about medicinal marijuana, there has been some research done into reducing or almost removing the THC from marijuana. Has there been much government recognition of that fact?
On the issue of medical marijuana, there has been significant recognition that the medical benefits are best applied by cannabis products that have extremely low THC content. Those are being produced now, they're being grown, very low THC marijuana is being grown, and also they're working on extracting the healthy cannabinoids from cannabis so that they eventually might be synthetically produced. So that is being recognized, but not in all locales. In some places it's still very, very naive about marijuana for pain reduction or for anti-nausea effects or for the prevention or remediation of epileptic type seizures in children. That's coming along in many of our medical marijuana places. The other problem, of course, is that many people are submitting kind of fake conditions to dispensaries that are not really being rigorous in their diagnosis of people. And that has to be worked out.
Dr. Cohen has consulted and lectured extensively for governmental and non-governmental organizations across the globe, including Kenya, India, Brazil, Singapore, Britain, and Australia. So Dr. Cohen, from your experience with all these international organizations, etc., what do you suggest to the youth of today who may be looking at recreational drugs for various different purposes, some being just for the fun of it, to get high, some needing and desperately needing emotional assistance with things like depression, anxiety, etc., and some who are actually just searching for themselves, as we did in the 60s?
There is a great deal of consistency across particularly Western cultures in terms of the recreational use of drugs and also the what we call self-medication uses. One of the properties of any of the drugs that might be being misused, including the cannabis drugs, the psychedelic drugs, the stimulants, the prescription drugs, opiates, the tranquilizers, steroids for that matter, is the difficulty of the users to perceive what's happening to them. Internationally, we find that often users tend to get addicted or very dependent before they're aware of the negative effects. That goes all the way from athletic performance and the destruction of tissues that steroids can provide to cannabis products, where it is very difficult to convince someone who is actually dependent on cannabis, on THC, and marijuana products, that they are dependent. They will insist they are not. We also find that there are risk factors that enter in, including problems with mental health, including to some degree socioeconomic problems. And most of the successful international responses have been comprehensive. What we know is people need to know about these drugs and what their effects are. They need to realize what the trouble spots are, what the symptoms are of increasing problems and addiction. The family and peer support must be there for the original motivations that they might be using these drugs. So community education is important. School-based